Gary Foster lies in a trauma bay with a massive intracranial hemorrhage. Dr. Choi prepares him for emergency surgery, but Gary refuses. He reveals a diagnosis of ALS. He knows the medical reality. Surgery leads to a permanent ventilator, not a recovery. He chooses to let the bleed take its course. His condition rapidly deteriorates into disseminated intravascular coagulation. Microclots form throughout his vascular system, starving his internal organs of oxygen. If the organs fail, Gary's final wish to be a donor dies with him. Gary demands heparin. The clinical trade-off is absolute. The anticoagulant will stop the clotting and preserve his organs for transplant, but it will accelerate the brain bleed, killing him in hours. The nursing staff protests, calling the act assisted suicide. Doctor Choi weighs the life of one terminal patient against the 58 people on the transplant waiting list. He makes a choice. Choi hangs the heparin bag himself, bypassing hospital protocol. He watches as the drug enters Gary's IV line. Gary's breathing becomes labored as the pressure in his skull spikes. He signs the final consent forms with a trembling hand. Minutes later, the monitors flatline. Gary Foster is pronounced dead. The surgical team moves in immediately to harvest the viable tissue. 58 people receive a second chance at life because a doctor agreed to speed up a death.